is joined by Mr Kelvin Ramsay, a leading London plastic and reconstructive surgeon. Today, we're discussing the breast reduction procedure. We consider the reasons why people have it, what's involved, and look at some patient success stories. Good morning, Mr Ramsay.
Good morning.
It's a pleasure to have you here. And could you tell us more about yourself and your work?
Of course. So my name's Kelvin. I'm a consultant plastic and reconstructive surgeon. I work in London. I have been a consultant for 13 years, and I work. My primary NHS hospital is the Royal Marsden Hospital, and I work at the Lister Hospital and a number of other hospitals around London, mainly performing breast surgery, reconstructive and cosmetic breast surgery, with some other interests.
Great, thank you so much. So let's get started with the questions. Why do people have breast reductions?
There are a number of reasons why a lady might consider having a breast reduction operation. It's obviously a big step for any lady to consider surgery such as this. But there are huge psychological and physical benefits to having a breast reduction, to the extent that until not that long ago, it was an operation offered by the NHS, but as a result of funding cuts, it isn't unfortunately available to most ladies on the NHS. It may be simply because their bust size is too generous, too large a bust that just gets in the way of their daily living, stops them from doing sports. But it also may affect their psychological approach to life. It can be quite challenging for some ladies when they have a very large bust, and that's something that they might want to consider addressing surgically. And it's difficult to address it without an operation in some ladies. In addition, just to the size and the breast size getting in the way, it can also lead to back pain, neck pain, shoulder discomfort, bra strap problems, and all sorts of things like that that can be relieved by the surgery.
Great. Yeah, I think, it's not necessarily just appearance, and some people seem to think, oh, it's just to do with your appearance, but there's so many different factors involved in it.
Sorry.
It's a deeply personal thing as well, I think.
Yes, I agree.
So, next question. Alongside aesthetics, does having breast reduction bring mental as well as physical relief?
For many ladies, yes. It depends on the case. And it's more of a sort of psychological well-being and confidence benefit that it brings to many patients. But if you look at a patient group, of all the patients I operate on within the sort of aesthetic breast world, my breast reduction patients are almost always the most pleased that they went through surgery, the most relieved to have the weight that they've been carrying around their necks and shoulders for so long reduced. And that brings a new freshness and happiness in life for some of them. And can really change their confidence levels and their ability to exercise, which is really important for psychological health. So yes, it's not just a physical benefit, and as you mentioned, the aesthetics, the cosmetic benefit is only one small part of it. The physical and psychological improvement that comes around from a breast reduction is significant.
Great, absolutely. So what's involved in the breast reduction procedure?
So the initial part of the process is, of course, meeting your surgeon in clinic, having at least a couple of consultations with me or another surgeon that does a similar procedure, talking through everything that's involved and making sure that the lady understands exactly what the process involves and what the surgery involves and what the recovery involves. After that, there will be discussions with some of the nurses and some of the secretarial staff, and it will involve an admission to a private hospital. The operation itself is a general anaesthetic operation. So you have a general anaesthetic, so you're put to sleep by a trained consultant anaesthetist who I work with regularly. And the operation itself takes somewhere between 2 and 3 hours. After that, the patient will go to the recovery area and then go back to their private room on the ward. And in my practice, they will have a one-night stay in hospital. The use of surgical drains, which are little plastic tubes that come out of the side of the breast that just stay in overnight for the first night, is sometimes needed, and that's another reason to have one night in hospital. After a quiet night recovering in the hospital beds, then I would come and see the patient the following morning, and generally the patients are then sent home late morning coffee time on the following day. Then after about a week, they return to see my nurses to have the dressings assessed, make sure everything's healing well, and then they'll have follow-up appointments with me subsequent to that to monitor their recovery.
Great. It's really nice to hear about that aftercare as well, even if it's just one night. You hear about stories in the press recently, people are going to other countries and finding, they're coming across some really difficult issues with their aftercare and things like that. It's so it's nice to hear that is a huge part of the procedure.
It's very important for the patient to know that it's not just an operation, it's an entire package of care, and the patient will be looked after by me and my nursing team throughout the before, during, and after surgery process. So yeah, it's an essential part of good medical practice and good surgical care.
Yeah, absolutely. So after going ahead with the operation, what should patients be aware of regarding scars, aftercare, and recovery?
So there are a few considerations with breast reduction surgery that we can discuss here. You can't perform a breast reduction without leaving scars, and no lady should be even considering the procedure unless she's been fully appraised of what the scars will look like. For most ladies, that will involve a scar around the nipple areola complex, around your nipple. Then there's a seam scar down the front of the breast, and then a scar in the fold underneath. So it's like an upturned anchor. And that scar is permanent. So what me and my team, my nursing team, will be doing in the post-operative phase is trying to make sure that that scar heals as well as possible and as quickly as possible. And then we give advice about what to put on the scar with respect to moisturizing creams and scar treatments to make the scar fade as quickly as possible. But it should be remembered that that scar is permanent. But eventually, in the vast majority of ladies, it's a barely perceptible thin pale line. But if you look carefully, you will always see it. The other things that one should consider is that in a lady who is considering breastfeeding in future, the operation of breast reduction surgery may have an effect on one's ability to breastfeed, but that's something that we can discuss in the clinic. And the other thing is that because you are operating on the inside of the breast, it can affect the sensation of the breast and the sensation of the nipples. Again, these are sort of patient orientated and discussions that are had in the clinic beforehand, well before you get to the operating room. With respect to aftercare and recovery, as I say, it's after the first week after surgery, you're taking it pretty gently. You've still got surgical dressings on. You're wearing a soft surgical bra that we will provide. And that soft surgical bra, most ladies wear for 4 to 6 weeks after the operation. And in the first few weeks, that's night and day, taking it off to wash, obviously. There'll be dressings on, as I say, for the first week, and then surgical tape after that. But the recovery takes about 6 weeks. And what do I mean by that? That means that the day after the operation, you walk out of hospital, you can go for a long walk, you can go out for lunch, but you're not doing anything strenuous, no heavy lifting, no sport. And you can't get back to heavy upper body exercise like Pilates, tennis, any sort of sport until 6 weeks, once everything's healed and the breasts have recovered.
Great, thank you. So final question. Can you share a success story regarding one of your patients who've had breast reduction surgery?
Yes, I can. There's a lady in her early 20s who had breast reduction about 12 months ago. She came to see me clearly very bothered by the very large size of her breast. They were well out of proportion with the rest of her frame, which was slim. And in addition to that, she had some significant asymmetry between the breasts. And not unsurprisingly, for a young lady at the beginning of her adult career, this was affecting her attitude to life, her attitude to relationships. Her confidence levels were very low, and she was really very distressed about the whole process, about the position that she was in. She was quite young. She was in her early 20s, and we always need to approach any surgery carefully, but particularly surgery on breasts in ladies in such a young age needs to be counselled very carefully with respect to, do you understand what you're going into? Have you thought about the scars? Have you thought about the effects on breastfeeding and so on? But she went on to, after a number of consultations, went on to have surgery very successfully under my care. And the change in her was dramatic. She was a different lady almost immediately. She was so happy afterwards. She healed very nicely. She got very good results. And I saw her a few times afterwards, and then got letters and messages from her saying how, her life had really changed, not because of necessarily anything that I'd done, but because of her opinion of herself had changed, because she wasn't dealing with the burden of large breasts and dealing with the asymmetry. Her confidence skyrocketed, and she's now gone from strength to strength. Now, I'm not saying that happens to everybody. As I said earlier, breast reduction for most ladies will lead to a happy outcome and many benefits. But that's one example of a lady who I think we really did help.
That's great. That's really great to hear. And I think it must be so rewarding as well for you, to have that result, it must be a really great feeling.
Yeah, it's a team effort for everybody involved, but it's nice to help a lady such as that have a relatively short operation recovery period, and then for her sake, I hope she never sees a surgeon again.
Yeah.
It's,
Yeah,
goes off and has a successful life.
that's great. Okay, so it's been fantastic speaking to you, Mr. Ramsay. Thank you so much.
Yeah, my pleasure. Thank you for your time.
No problem. So, if you're interested in expert breast reduction surgery from this prominent surgeon, visit Mr. Ramsay's profile at topdoctors.co.uk.